The most novel updates that have occurred to the approach to the diagnosis and management of fractures in patients with chronic kidney disease have really occurred over the past year or two. Our guideline body, KDIGO, has updated the guideline on fracture risk screening to indicate that we should now, or that we now can use bone density screening to assess for osteoporosis and fracture risk. And that was based on 4 prospective studies of DEXA scanning in patients across the spectrum of renal failure. And all of those studies indicated that low bone mineral density, defined by either the WHO T-score or by standard deviation decrease in femoral neck or radius BMD, was associated with an increased risk of fractures. And that prediction was equivalent in CKD patients as it was to patients with healthy kidney function. Now, those were important studies because finally they give us a tool by which we can screen our patients for fractures, whether they are pre-dialysis CKD, on dialysis, or even after transplantation. And that new diagnostic approach is important because now we can assess which of our patients may benefit from fracture prevention therapies. Unfortunately, we don't have any proven fracture prevention therapies that have been studied in randomized clinical trials in patients with severe CKD, including dialysis, transplant, or with CKD MBD pre-dialysis. And for the future, I think that what we need are drugs that have been designed specifically for our CKD patients and randomized trials with hard clinical endpoints indicating that these drugs are safe and effective. In the meantime, we can continue to use drugs that we use in the general population to treat our patients with CKD without MBD, and there is growing comfort with the use of these drugs also in patients with CKD, MBD, and more severe renal failure. So hopefully, in the near future, we can come back here and we can say that now we have a battery of drugs that can be used to prevent fractures in CKD patients, and hopefully we can save lives by keeping our patients fracture-free.